New Hampshire healthcare, of course, has strengths and weaknesses. All states do. On the strength sides, just to name a few, New Hampshire is home to many high quality medical facilities, as we know, and talented medical professionals. In clinical care, we're pretty good on a lot of measures, such as high rates of preventive screening and high rates of immunization, low rates of hospital readmissions, depending on how you look at it. According to America's Health Rankings, which is put out by the United Health Foundation, clinical care in New Hampshire ranks 11th best in the nation. Our residents seem to be relatively healthy compared to residents of other states, so that's pretty good. It's not all great though. On the weaknesses side, New Hampshire is comparatively thin on certain types of healthcare facility capacity. So that's sort of like the supply side. We rank 37th in the nation in terms of available hospital beds. We have barely more than 2 hospital beds per 1,000 population. Other states have more. We have about 1.9 ICU beds per 10,000 population, and that puts New Hampshire 45th in terms of ICU capacity. So compared to other states, we're low on that, and we also don't have a lot of ambulatory surgery center capacity either. Continuing on with the weaknesses, healthcare is also fairly expensive for New Hampshire residents, although certainly individuals purchasing health insurance on New Hampshire's federally facilitated health insurance marketplace can do so relatively inexpensively. I think we're 7th cheapest in the nation on that. That option is actually only open to about 3% of the state population, so 44,000 people out of about 1.4 million or so. Many more Granite Staters, 56% of the people in the state purchase health insurance through their employers. And those workers pay an average annual premium for individual coverage of over $7,000, that would be the 11th most expensive in the country. And for family coverage, it's $20,000 per year. Like everywhere, I think the way that we pay for healthcare in New Hampshire is dominated by what I would call conventional approaches. Those conventional approaches are private insurance, public programs such as Medicare, Medicaid, and CHIP. So that's a super quick sketch of the sort of status quo.